We lose so much. That's where we gave malaria priority. It kills more Tanzanians than any other disease. Malaria occupies more the doctors and nurses. It takes the lion's share of the healthcare budget. It keeps people out of work, it keeps children out of school. In Muleba district, there was a time when attendance was less than 60%. Now what did we decide to do with malaria? We came up with a new policy. We said, let's try to find a way of making sure that every Tanzanian sleeps under a long-lasting insecticide-treated bed net. We started with a program of subsidized nets. We used to subsidize pregnant mothers, children under 5. And now we have a program of a nationwide distribution of bed nets at every bedside. We looked at the effective drugs. We should use artemisinin combination therapy. We introduced a system of subsidies again to make them affordable. Indoor residual spraying, we had done that with Zanzibar with great successes. We've now started on the mainland. We started with the Lake Victoria area where the incidence of malaria is the highest. I remember in one region, Kagera region, is 41%. We are now planning seriously on this program of killing malaria at source. We have got to continue with the mobilization. Programs like Zinduka, where we launch this major campaign. These kinds of messages that are all constantly on the radio, on the television, using all our celebrities, the print and electronic media has been effective so far. But of course, again, as I said, is commitment. Political leadership that has a big role, political will to fight the disease. This is precisely what we've been doing with the African Leaders Malaria Alliance. We need to work together, pool our resources, coordinate our efforts. We were working individually in our countries, but now we are working as a team. Rollback Malaria came to our support, Global Fund came to our support, getting over 16 million bed nets. Actually, it is through the efforts of ALMA. The phenomenal success that we have made in these few years has been a combination now of our own efforts, supplemented by efforts of our friends in the world. Visitations of malaria cases to hospitals have been cut by half, from 40% to only 20%. Deaths have been cut by half. In the past, used to be full of malaria patients. Now we have empty beds. Our doctors now have time to attend to other diseases. It's leadership that makes the difference. If we maintain political will, take the right political decisions and make the right interventions, I'm sure by 2015 we should be able to eliminate malaria altogether. So no, everybody else will be happy. The people in Africa will be happy and everybody else in the world visiting us